Good morning, everyone. This is Lori Stillman from Health Resources in Action. HIA is very pleased to sponsor this training series, The Promise and Practice of Health Impact Assessments, which hundreds of people from across New England have been participating in over these past few months to learn more about the field of using health impact assessments to improve population health through prevention. Health Resources in Action is a national nonprofit public health and medical research organization located in Boston, and we are dedicated to promoting healthy communities through partnerships with community and philanthropic organizations and governmental agencies across the country. Our staff are trained in and are beginning to put into practice HIAs, and we look forward to partnering with many of you with similar interests as we seek to promote putting HIAs into wider practice across the region. Today, we're presenting the last of the training series, a webinar on the reporting and evaluation steps of health impact assessments. And here with us to provide this 90-minute training from Georgia is Dr. Holly Avey, who is an Associate Project Director at the Georgia Health Policy Center. Her interests include the intersection of health policy and social policy through the Health in All Policies framework, and utilizing assessment tools and community-based participatory research. She's a national trainer, advisor, and practitioner on health impact assessments, and we are so pleased that she can join us today. Dr. Holly Avey.
This morning I'm going to talk about reporting and evaluation, and also as a part of reporting I'm also going to talk a little bit about communication, which I consider to be a slightly separate topic area. So we will talk We'll talk about reporting, communications, and monitoring and evaluation. The first topic I'll talk about is reporting. After you've completed the 6 steps of your health impact assessment, or the first 5 steps, the final 2 steps are to create your report to document what you've gone through with the health impact assessment, and then to explore evaluation, which ideally would be something that you've been thinking about during the course of your entire health impact assessment rather than just something that happens at the end. So I'll talk with you a little bit about what the key elements should be within an HIA report, how to make sure that your report is a really solid, good report, anything that you might need to consider in terms of equity as you create your report and disseminate it, and the reports and research findings, the ways that you can summarize those. So we'll talk a little bit more about that. The first part that I'll mention is what you should make sure to include in your report, and that is that you want to make sure you have an executive summary that shows the key findings. This may seem obvious, but one of the most important tools that you will use for your health impact assessment is a brief summary of the findings. It's not likely that many people will be reading the full report that you'll create, although some will hopefully explore it in great detail. But you want to make sure that you've got a short and quick summary that will be accessible to a variety of different stakeholders, that highlights the key findings and recommendations and is accessible to the specific audiences that you hope to communicate with. In addition, you'll provide an introduction and background that will give some of the context for the project that you conducted your HIA on. You give a description of each of the different 6 steps of the HIA process that you'll be engaging in. You also want to specifically mention the degree to which you engaged your stakeholders, who those stakeholders were, how you went about the process of engaging them. And again, although it may seem obvious, it is really important to offer a conclusion in your HIA report, because you want to be able to offer someone who's reading your final report what the ultimate findings were and where that leads you in terms of recommendations and also in terms of possible next steps to continue with the research or with the assessment phase. Make sure to include references, and also feel free to include appendices. They could be anything from maps of the area if it has a geographic component to it. It could include, in some cases, there may be some feedback that you received from stakeholders or from others that didn't quite meet the scoping criteria of your health impact assessment, but it's important to document and share that with others as well. That would be entirely appropriate to include in an appendix as well. So these are just some of the really basic elements of an HIA report. What makes a good report includes, in addition to mentioning the executive summary, having it be really succinct, as I mentioned, you have that section for each of the different steps that documents the process. So it's not just the findings for each of the steps, but it's really walking people through, almost like a narrative, in telling the story of what you did for your HIA, how you engaged in each step, what your thought processes were. Feel free to mention in each of these different steps any changes in direction that you might have taken. It's one of the most important things with developing and strengthening our HIA field is just making sure that we're transparent in our decision-making processes. So it may be that your final scope that you focused on to create your assessment for the HIA is much smaller or much more streamlined than the first scope that you created. And you could talk about that in the scoping step of the HIA report. Talk about how you initially considered it, which sources of feedback you used. You might have had sessions with community members. You might have looked into the literature. You might have had a lot of different ideas that created an initial scope, and then try to, and then perhaps you needed to streamline that because of limited data availability. It may have been limited resources for your staffing for the HIA process, or it may have been that in exploring the literature that certain pathways just fell out and didn't have any the data that was expected. All of those kinds of things would be entirely appropriate and really highly valued from an HIA practitioner perspective in understanding how each of us goes through this process and how we can continue to explore it and strengthen that. In the assessment section, you want to make sure that you discuss the evidence and the data sources that you used, the methods you used. If you used any methods that people may not be familiar with, it would be important to provide a description of that methodology. And again, for recommendations, as you may have learned previously in other information about health impact assessment, you want to make sure that your recommendations are specific, that they may be targeted to decision alternatives, policy recommendations. You may be offering recommendations that are specific for mitigation purposes. You want to make sure that you get stakeholder input, and this can be done in a variety of different ways. You can provide stakeholders a draft of an executive summary and ask them to provide feedback on that before it's released to the public. You can ask stakeholders, or you can announce to stakeholders that there's a comment period on a complete report. You can post a draft of a report on your website or share it in a variety of different venues, and then allow for a comment period when people can post any concerns that they may have, any options for recommendations to strengthen the final report. And you can incorporate that in feedback, or at the very minimum, you can document that as an additional appendix so that people feel like they've had an opportunity to be heard. That you want to make sure that the report is open to equity considerations and accessible to a variety of different audiences, especially whichever key audiences are relevant to the topic of the HIA itself. And I'll talk a little bit more about that in a second. When summarizing report and research findings, you want to make sure that you use, to the extent possible, and I know that some of us are going to have some pretty limited financial options to create graphic design elements for final reports. But it really does go a long way in helping people to be able to digest the information that you may have and to be able to create a format that people can absorb a great deal of information or complex information. Creating tables, charts, creating different ways of representing information and summarizing it, as you can see from this example from an upstream public health HIA that was completed. It can really help the reader to understand the data in greater detail. So you may want to consider options for graphic design. You'd also be of benefit to have tables that have a way of characterizing the evidence that you offer to people. And by characterizing the evidence, I mean that it's good to describe the strength, the magnitude of impact, the distribution, the direction in terms of is it a positive or negative outcome that you anticipate, even identifying the quality of evidence that you have in terms of the strength. And that could be, if you look to the legend, that the column all the way on the right talks about the quality of evidence and lists different numbers of asterisks or stars to identify that. And then the legend on the left describes what those indicate. And it would be even stronger to be able to define what that legend means in terms of what constitutes a strong study, what constitutes a weak study or a moderate quality. That could be done in a narrative in the methodology section. Just want to give you some examples of things to think about in terms of how to share the data that you've collected and analyzed, and how to provide as much detail as possible to the reader so that they can fully comprehend the strength of the evidence and the characteristics of the evidence that you are offering. When thinking about the equity considerations in reporting and communications, there are a variety of different issues that you can consider. They include how and to what extent you engage your stakeholder groups, the different types of tools that you'll use to communicate the findings, thinking in advance about any languages that you may need to consider translating the information into, and how you will plan on disseminating the information. So for example, with stakeholder engagement, it may be that you might want to consider how you plan to engage stakeholders in contributing in that final report. It may be, as I mentioned, getting feedback on an executive summary. It may be getting feedback on the wording of the recommendations and their prioritization of those recommendations, or it may be a comment period for a final, a complete report. It's also important to think about whether or not you anticipate that your stakeholder groups may want to create their own materials as a result of the HIA that you've completed. It may be that some groups, whether they're formally a part of your stakeholder group for the HIA process, or they may be interested parties who did not participate in the process, some of them may have a deep interest in circulating and disseminating the information that is provided in your HIA report. To the extent that you expect that the information may be difficult for certain groups to interpret accurately, or it may be that there's a very politicized topic area that is the topic of the HIA, and you want to make sure that the information is communicated accurately and appropriately based on the way that the evidence was assessed in your HIA, it may be worth your time to think about communicating with your stakeholder group, your advisory group, your steering committee, however you've engaged your stakeholders, in explicitly talking with them about what your expectations are in terms of how to communicate the information to others, what messages you may want to come to consensus with groups about the messages that would be appropriate and accurate, that are accurately representing the HIA findings, and how that can be shared. It's still allowing each group to have their own perspective and viewpoint in the topic at large, but how to come to consensus on sharing the actual findings of the HIA. And that may be in terms of messages, or it may be in terms of whether or not you feel that it's appropriate to create their own materials. There may be a tagline that you want people to use that says specifically information was offered through this HIA, that sort of thing. Equity considerations are another thing to think about as you are working on reporting and communications. You may want to consider whether or not stakeholders or residents or different populations that are affected by the topic of the HIA, if they've been participating in the actual data collection or assessment phase, then what would be their appropriate role in representing those the data findings in the reporting phase. You may also want to consider if the materials need to be translated to other languages and how that might be done, if it's a translation of the executive summary of the complete report, who would be doing the translation services, and how the materials would be disseminated. It may be that disseminating electronically could eliminate access for certain populations that are of interest for the topic of the HIA. So these are all just issues to consider as you're working through the process of reporting and communicating the findings of your HIA. Talking a little bit more now about communications, there are some things that you can think about in advance about how to disseminate the information from your HIA report. And the more that you can plan ahead for these kinds of things, the more that you can anticipate any potential challenges, work through them in advance, and really maximize the opportunity to communicate these findings with the critical groups who are your audience members. That includes creating a communication plan, identifying strategies of communication for different stages of the HIA process, identifying which communication materials you anticipate using, how you plan to engage stakeholders and disseminate the information, which I've discussed already to some extent. There may be some innovative communication strategies that other HIA practitioners have used that you could learn from and utilize yourself. There are specific tactics to consider. And I also wanted to share with you some practitioner perspectives on communication challenges and ideas from some recent meetings that may be of relevance to you. In speaking about a communication plan, you want to communicate your findings and recommendations in ways that will be compelling and effective to the decision makers. And the key elements to consider in creating your communication plan is what the target messages would be for specific audiences. It may be helpful to think about who your audiences will be and to break those apart into different groups. It may be that your decision makers need to have a different strategy of approaching and communicating with them in comparison to your stakeholder groups. It may be that you have different types of stakeholder groups that also require different target messages. You want to then develop your key messages and frames and think about the materials that you will use to communicate. And that could be things like executive summaries, comment letters, fact sheets. You could even offer testimony in terms of if the HIA topic is related to policy that's pending in legislation. It's important to identify spokespeople. These may be people from your own organization or from the HIA team, but again, thinking ahead about the possibility that some of your stakeholder groups may also be spokespeople. It may be very powerful to have someone who has the HIA findings in the final report, but is also a good example of what some of the consequences might be for some of the negative findings, or someone who could speak very passionately about the potential for the positive outcomes. Thinking about the spokespeople that you may engage could also be a great tool to think about. And you want to think about the timing and the method of the communication, as well as developing a dissemination plan. In terms of thinking about the different strategies that you might use for communicating throughout the different stages or steps of the HIA process, you may want to approach people differently depending on where you are in your HIA process. At the beginning, it may be important for you to gather support, not only from your stakeholder groups in terms of soliciting their participation in an advisory committee, helping them understand what the HIA is going to be like, what the process will be about, understanding their, creating the appropriate expectations for the process. It may also be gathering support from the larger community who could potentially be partners with you in the future for other HIA work, and helping them understand what the HIA process is and gathering their interest so that they could follow along as you work on this particular HIA and then potentially partner with you in the future. As you are going through the middle stages of the HIA process, you may want to shift a little bit to the idea of not so much educating people on what the HIA process is in general, but keeping them continually engaged in the actual steps of the HIA itself. That may be through email newsletters, that may be through periodic meetings, through phone calls or emails. You could have a variety of different strategies there, but it is helpful to give frequent updates to people who are key strategy or key partners or stakeholders in your HIA process, so that you can keep them engaged and on board. in the end, you want to be able to garner people's support to help you implement the findings and the recommendations and share that information with others. So your communication strategies with them at that point would be to perhaps confirm that they are comfortable with the findings, talk through any details related to that, and engage them to help you in sharing that information with others, as well as engaging them in helping to monitor potential outcomes further down the road. All right. So some of the communication materials that you could consider using include, as I've talked about before, you really want to focus a lot of your time and attention on making sure that you have a strong executive summary. Something that it could be one page front and back. It could be up to 6-page booklet, something like that. But it really needs to be pretty short and sweet. Graphics would be ideal. Something that can gather people's attention and that really effectively communicates the findings. Fact sheets can also be helpful. You can strategically identify an opportunity for press releases, newsletters, as I mentioned, either email newsletters or through the mail. You may want to offer a variety of different presentations to different stakeholder groups, including city councils or different decision makers or audiences. You may want to offer an opinion piece or an editorial piece in the newspaper or on a blog. You may want to notify news options, news contacts, whether it's radio or TV, that sort of thing, to explore the potential for being interviewed. As I mentioned, that in some cases it may be that you could offer an opportunity for testimony on something that's being considered. And health impact assessments are not often published in peer-reviewed literature at this point, but it would definitely be an enhancement to our field to continue to strive towards that. And so thinking about all of these different options and where you want to focus your resources and your attention before you get to that final stage could really be helpful, especially if your resources are limited and you want to make sure that you get the best bang for your buck. Then you want to make sure that you're thinking about this in advance so that you can identify the information that would be most helpful for that process. We've talked a little bit already about stakeholder engagement. One of the reasons that it's important to engage stakeholders throughout this process is that they really can provide you more local, relevant knowledge than you'll ever be able to offer yourself. And it can be a critical piece in being able to share the information in a relevant and meaningful way to decision makers and other stakeholder groups. When you are ready to release the report, you want to be communicating with your stakeholders in order to make sure that you understand the context of the findings that you have and that the relevance is appropriate. You want to get their buy-in as much as possible. You may even find that you can get some fantastic quotes that would be great to include in some of the executive summaries or the press releases and that sort of thing. You can also test messages with different groups. It may be that certain words are red flags for certain people or that they don't resonate as well as others, and being able to communicate that behind the scenes before you go public can be very helpful. As I mentioned before, there may be times when you identify stakeholders as spokespeople for presenting the HIA results and recommendations, and it is helpful to think about whether or not you feel comfortable with those stakeholder groups creating their own materials using the HIA results and identifying what messages, if that's the case, or if they intend to communicate the findings themselves, what messages are appropriate or perhaps what are inappropriate. In terms of thinking about a dissemination plan, in addition to identifying who your target audience is, what the messages are, and what the materials are that you'll use to communicate those messages, you also want to think about how you're going to disseminate this information. So you've identified your audience, your key messages, which may be specific to different audience groups, those materials or formats for the audiences, and how you will disseminate them. You also think about the spokesperson or people that you think would be best for each audience group, and you want to make sure that there is a designated person responsible for coordinating all of this communication. Some of the communication strategies that have been used by other HIA practitioners that have an innovative perspective to them that you could consider include hosting a workshop with stakeholders as an opportunity to come to consensus on the specific messages and to clarify roles with the different groups in who's responsible for disseminating those messages and to what extent. There was one group that invited legislators to visit the community gardens that were offered as a part of the topic or the focus of their HIA and the school cafeterias. And that was an HIA that was on the county agricultural plan. So it was an opportunity for legislators, kind of a photo op opportunity for them, but it was a way to engage them in talking about the findings of the HIA. You could also think about a release of the findings or the results of the HIA in the context of a community event or a celebration that's designed to get people involved so that it's not only thought about in terms of a passive sharing of information, but that it's more of a kickoff of getting people enthusiastic about the next steps of the process for the HIA. Some of the tactics that you can think about for written materials, I've mentioned before, there are one-pagers, there are executive summaries and full reports. When you're thinking about presentations, you may think about who the audience might be for those presentations. It could be community members, it could be public agency meetings. You might have an HIA networking group in your area that could be of interest, or a networking group related to the topic of your HIA, whether it's transportation or education or housing, that sort of thing. There might be specific workshops, webinars, conferences that are coming up that you could consider sharing the information in that format as well. In terms of earned media, you may think about offering press releases, pitching the topic to reporters, looking for editorial board meetings where you could participate and offer the opportunity to, or the idea of sharing the HIA results in that way. From online outreach, thinking about creating a website where you can post electronic versions or a web page to post electronic versions of the reports. You may want to cross-post to other websites, blogs. That may be on the website of the organization that sponsored or conducted the HIA. It may also be that you post the findings on HIA practitioner websites in general, such as the Health Impact Project or the UCLA HIA Click site, other sites, other blogs where HIA practitioners are frequently going for information. You may want to think about social media. Twitter and Facebook can be used not only to announce information, but also as a tool for the ongoing engagement of stakeholders throughout the entire HIA process. It can create a community and a natural channel for dissemination. And as I mentioned before, there may be HIA network groups with people from a variety of fields in your area that you could utilize as well. Some of the, there's a meeting that's called HIA of the Americas Workshop, and it is a meeting that is conducted for HIA practitioners. And the idea is for practitioners to meet and discuss some of the exciting things about the field as it's growing, but also to discuss some of the challenges in the HIA field and be able to identify opportunities to address those challenges. There was a recent workshop in the last meeting that talked about reporting and communications, and the practitioners in this workshop talked about the specific tactics that have been used, their perspectives on some of the benefits, and some of the challenges as well. So I just wanted to share some of the findings with that from that workshop with you all. In terms of specific tactics, for example, an executive summary, the benefit of it is that it is short and concise and is really to the point, which means that it's much more readily accessible to very busy decision makers who often need to come through a great deal of information and make decisions quickly. The challenge with that is trying to identify when you have collected so much information, and you might have a great deal of number of recommendations that you've identified for your HIA. Trying to figure out what to include, what not to include can be a real challenge. In that case, looking at other HIA reports that have already been completed, looking at the executive summaries of those reports as examples, talking with other HIA practitioners about the ways in which they sorted through trying to identify what to include and not include could be really helpful to work through that process. The full report offers the benefit of providing an opportunity to really show the details for those other HIA practitioners who may want to understand more about what you did, what your process was, and to be able to learn from it, both for your own benefit as well as for others. You can also think about open comment sessions at meetings. Testimony is a great option to pair with an executive summary and to be able to present to specific stakeholders. The challenge in a testimonial option is making sure that you can get invited in the first place. So you may want to think about building the relationships needed in order to get that, solicit that invitation in advance. You can think about online outreach and social media. The challenge there may be that people may not share the information in context. You don't always have as much control over the way in which people share information when it's released in that manner. So thinking about that perspective could be helpful as well. You can also think about one-on-one meetings with decision makers, because that allows you an opportunity to communicate the information in manageable chunks and to connect to other resources as needed. So it may be that you share some information with the decision maker about the findings, and then they have further questions, and you can circle back as because of the fact that it was a private conversation. It doesn't need to be that people feel uncomfortable about revealing that they need more information, and that you can really provide them with the very specific information that's most useful to them. And then opinion pieces or editorials provide more room to explain the context of a piece. So all of these have different pros and cons to them, and you can think about what might work best for your particular situation. As I mentioned before, one of the challenges with communicating HIA results can be in making sure that the results are communicated accurately and effectively. That's very challenging when trying to summarize it into a brief summary or an executive summary, and a little bit easier to do if you have the opportunity to explore it in a full report. How you communicate it is you want to be very clear on identifying and recording the strength of your evidence, and you also want to make sure that you're communicating it effectively by knowing who your audience is, what they're likely to understand, or what may need to be further explained to them. Visualizing data can be a very powerful way to explain things that are complex. That can be through GIS mapping, that can be through infographics, a variety of different techniques. Again, many of us do not have those skills ourselves, and it may be something that you need to budget in terms of planning for in advance to be able to hire someone with specific expertise in this area to really be the most effective communicator in your findings. And then there are some very general rules that you can follow in terms of communicating information effectively to a variety of different audiences, and that includes things like using short or fewer words, blank space, and graphics. All of those enhance the readability of your findings and make them more accessible. A lot of people assume that if you are increasing the readability of materials that you are dumbing it down or making it too simplistic. In fact, you're making it more accessible to a broad range of readers, and many of the readers that may be your primary audience members are very busy, and even if they have the background to be able to interpret more complex information, they may not have the time or the energy to work through a densely worded product. So using these techniques can be very meaningful for a variety of different audiences. The use of analogies can also be very helpful in trying to explain complex concepts. All right, so from there, now we're going to switch gears a little bit. We've talked about how to report the findings of your HIA, how to communicate them to others. We're now going to talk about how important it is to also evaluate the process of completing the HIA and the impact and outcomes of that. There are three main types of evaluation that are often used for health impact assessment. They include a process evaluation, impact, and outcome. Monitoring is a way of collecting the information that you may use to inform each of those three different processes. There's also a type of evaluation that's called developmental evaluation. It's not often mentioned in the HIA field as yet. it is something that I find interesting and thought that I would go ahead and include in this webinar, and hopefully not in a way that's confusing or that makes it too muddies the water too much, but I do think that it has some relevance that may be of interest to people. You also, as you're creating your evaluation plan, you want to think about the timeline that you'll be using and the opportunity to engage in evaluation from the very beginning of your HIA process. It's also important to consider whether or not you intend to engage in a self-evaluation or hire an external evaluator to address some of the evaluation questions that you may have. Some issues to consider as you're creating your evaluation plan, again, include stakeholder engagement and equity issues, as well as ways to communicate about the evaluation plan itself. And then finally, I'll talk about some of the benefits of the evaluation process and ways that the HIA field still has a little room to grow as it relates to the evaluation and monitoring of HIAs. So talking in a little bit more detail about the different types of evaluation. Process evaluation considers whether the HIA was carried out according to the plan of action and applicable standards. So if you were engaging in a process evaluation, the first thing that you might want to do is to think about what were your goals that you wanted to accomplish with your HIA. And this is where it's helpful to think about this in advance so that you don't get to the end of your HIA and realize, well, we didn't actually articulate them in advance. We know generally that we wanted to provide information to influence the decision makers, but we didn't actually write that down. If you think about it in advance, then you have some specific goals that you can then go back and determine whether or not you met those goals as a part of your process evaluation. And it might be that you have multiple goals for your HIA process. You might have a goal to influence, to inform the decision-making process. You might also have a goal to build partnerships with the stakeholder groups that are engaged in the HIA. Or you might have a goal to build capacity in HIA practice within your organization and to build interest in future HIA work with other key partners in your area. So there could be a variety of different goals that you can assess as a part of your process evaluation afterwards. In terms of applicable standards, there is a document that's called the Minimum Elements and Practice Standards of HIA that's been released as a part of the HIA of the Americas workshop. And it identifies what the minimum elements for each step of the HIA process are. There's also a document that's been released by the National Academy of Sciences on health impact assessment, which documents the outputs that should be expected for each HIA step. You could use those minimum elements and the outputs that have been documented in those two documents as the standards that you should be following for each of your HIA steps, which you can measure yourself against as a part of your process evaluation. Impact evaluation seeks to understand the impact of the HIA on the decision-making process or other factors being considered that are related to that specific decision. And that would be the extent to which the decision makers actually incorporated any of your recommendations into the final process, or if they did not, and other factors, contextual factors that may be related to the degree to which they incorporated the feedback. The outcome evaluation focuses more on the long-term process and the degree to which the recommendations, which may or may not have been implemented, have had an effect on the health status or the health indicators identified during the HIA process. Monitoring is the process of tracking these outcomes and data that you would need for the process impact or outcome evaluation over time to be able to document those efforts. Process evaluation can range from a simple self-assessment to a more comprehensive case study. It can describe, track, or measure your achievement of those HIA goals I mentioned. It would be good to document the methods that you've used, the approaches that you identified in addressing the analytic challenges. It's helpful thinking about what you would include in a strong assessment summary for your final report. You would have the degree of certainty or predictions you have in your findings. You would have a description of how you engaged your stakeholder groups and the methods for interacting with decision makers. So it's really just a narrative description of the process of engaging in the HIA. You can also seek to evaluate the HIA process more holistically thinking about the degree to which you were successful in accomplishing each of those HIA goals, in accomplishing the stakeholder engagement, and in the degree to which people who were external to your process felt comfortable with it along the way. So as I mentioned, you can have a variety of different goals for your HIA. I just wanted to give you a few examples of things that you could consider. These include providing the project steering committee, other interested stakeholders with the information about the health impacts. It may be that one of your goals is not only to influence the final decision-making process, but even if that is not as successful as you had hoped, you may still feel like you've accomplished something by bringing a greater awareness among the decision makers in the relationship with the sector that they work in and the health outcomes that you've identified. So it could be to provide decision makers with information, with an HIA, an example of an HIA that will inform their consideration of its utility in aiding decision making in the future, increasing understanding among stakeholders, helping an organization conduct HIA and develop the capacity, and making sure that the HIA conforms with those practice standards and minimum elements that I mentioned. Some examples of evaluation questions that are focused on process evaluation you could think about in terms of the steps of the HIA. Did you follow the best practices in each HIA step? Why or why not? How could each step have been improved? Specific to screening, looking back, was it an appropriate project or policy for an HIA? Who was involved in the scoping? Were the relevant stakeholders involved? What was the final HIA? Was the final HIA consistent with the scoping plan? How did you prioritize health issues? These are all, I just wanted to give you a whole slew of information or examples of different evaluation questions that you can use. I won't go through all of them here. And I do want to thank Noelle Dobson from the Oregon Public Health Institute for creating many of these questions that are offered here. Again, for assessment, you could ask about describing the degree to which the assumptions and limitations of the assessment were documented, how you utilized community experience as evidence, new research being conducted that was incorporated into the HIA findings. Each step of the process, you just want to ask yourself, how could it have been improved, and how could the process of going through that in terms of perhaps prioritizing recommendations, did that process, was it successful for you? Can you think of ways you would tweak it in the future? Thinking again about reporting and communications, you might find after the fact, as many of us do, that there are certain ways that are less successful than you had hoped or anticipated, and those lessons learned can be really valuable, not only for yourself as a future HIA practitioner, but also for others. So it would be great to share that. Stakeholder engagement is something that people are learning more and more about. There's a lot of relevance with the community-based participatory research field that we can learn from, but there are also things that are specific to the HIA process in terms of timing, in terms of politically polarized issues that can be very helpful to reflect on and learn from. And there's also the part about managing or evaluating the process that really looks at how you just conducted the HIA itself. Did you have a work plan from the very beginning? Were you able to follow that work plan? Was it helpful? How much staff time did you use in the HIA, and how many resources were devoted to conducting this HIA? That could be really critical information for you to be able to assess the degree to which your organization can continue to participate in this sort of thing in the future, or to prepare for how to engage in HIAs in the future, to identify ways to streamline. Do you feel like your organization's capacity in HIA was enhanced as a part of going through the first process? Did you utilize as many volunteers and partners in the process as you could have? How did the timeline need to fluctuate, or what were some elements of the timeline that could have been revised in the future? Was there any part of the process in terms of the stakeholder engagement that would have benefited from perhaps more formalized agreements or communications? thinking about all of that can really be helpful in planning for the future. Then we get to impact evaluation, and that as a focus on whether or not the recommendations that you offer were adopted and implemented by the decision makers. You also want to assess whether the HIA had other effects, such as building new collaboration, increasing awareness of unrecognized health impacts, identifying data gaps or need for future research, foundation for future monitoring, and ensuring the public has the information about the health effects as well. Some sample questions you could consider for impact evaluation. Did the HIA lead to changes? Were recommendations included in the final decision? Did it inform a discussion of the trade-off? Did it help to build consensus and buy-in for policy decisions? Did it prevent project delays by anticipating project concerns? Did the project help to secure funds for project mitigation? It's helpful to think about in terms of impact. Many times people who are just learning about the field of HIA have a great deal of concern about the fact that the HIA may add to their timeline or their bottom line, their expenses. And the degree to which you can monitor that and be able to document whether or not it did and whether it may have saved time or saved finances in the long run by stopping any potential contentious issues that the decision makers may have had to deal with in other ways through the stakeholder engagement piece. That can be a very valuable tool in the future. Additional impact evaluation questions. Any unintended impacts? Was the process useful to decision makers? Are there efforts to institutionalize HIA? Did it lead to any other policies that were not the subject of the HIA? Just a variety of different additional questions to think about. And also, these are focused on partners and stakeholders. Did it lead to new partnerships? Did it empower engaged parties? Did it lead to cross-sector collaboration? Methods to gather, process, and impact data include surveys. You could have before and after focus groups or other data collection processes with the HIA participants. You could engage in key informant interviews with those partners or stakeholders. You could have a document review or review meetings or minutes from public meetings, from network groups, decision-maker groups. You could assess the scoping worksheets and work plans that you may have created at the beginning to determine whether or not you were consistent with them. Look at email exchanges, media reviews, a variety of different techniques that way. The third type of evaluation is outcome evaluation, which focuses on whether or not the implementation of the decision had actual effects on health or health determinants as anticipated. So that has a greater expectation from the beginning. You really have to have a suitable research design, ideally with an appropriate comparison group. You would need to be collecting or monitoring data on the outcomes or the determinants of interest for an extended period of time. And outcome evaluation considers the effects of the decision as a whole. Therefore, it's generally not possible to attribute outcomes to HIA recommendations. So it's not likely to be a causal study. It would be more focused on that comparison group, and it is quite a bit more of an investment. You may ask yourself questions focused on the determinants in terms of the changes in the presence or absence of determinants, a plan for monitoring changes, were there changes in the outcomes, and is there a plan for monitoring those changes? Here's just an example of an evaluation matrix that you might want to consider, and you can see you've got the question that you may want to ask yourself. You may want to think about what indicator you would need to access, the type of method that you would use, and who would be responsible. And you can see that Steve is a very helpful person here. He's listed a lot. You might have things like asking yourself how much staff and volunteer time did you spend. The indicator would be the number of hours, and you might need to create a specific tracking method. Your best guess could be the next best option if you didn't think about it in advance, but that's, again, one of the ways where thinking in advance and working through the process evaluation in particular as you're going through each of the steps of the HIA can really be helpful. And there are a variety of different other examples there. Monitoring means that you're providing information that allows one to conduct the evaluations noted above. The way that you might engage in monitoring would be to, so for example, if you're thinking about the outcomes evaluation, you might monitor childhood asthma rates by race or income according to the data that you collect from the local health department. And perhaps it's the local health department who is responsible for monitoring that data in the first place and informing any of the different stakeholders of the HIA process. So you can really solicit the participation of other partners in the HIA process as it relates to the monitoring of impact and outcome data in particular. You might also have specific recommendations that have to do with mitigating potential negative health outcomes, and you could look at what the mitigation recommendation is, what the method that you're going to use for monitoring, who would be responsible. It's really important to designate that in advance, the timeline for when you anticipate that would be happening, and you may even want to have a conversation with your stakeholder groups about what the potential action might be if compliance is not successful in the mitigation recommendation that you've offered. And I just want to mention that there is one additional type of evaluation that you could consider as it relates to evaluation of health impact assessment, and it's probably most closely related to a process evaluation. It's called developmental evaluation, and I've listed the source here at the bottom of the screen, and it's from a book that's written by Michael Quinn Patton, who is very well known in specifically in the qualitative evaluation field. He has identified this specific type of evaluation to focus on projects, policies, programs, other interventions that are happening in a complex or dynamic environment that are in the process of being developed at that time. So if the topic of your HIA is something that is in the process of being developed and you feel like it will continue to go through a developmental period after your HIA has been completed, thinking about focusing your process evaluation in a way that could also accommodate some additional, perhaps developmental evaluation questions may be something that could be of benefit to you as well as to those decision makers who are going to be involved in the long term in the in that topic that the HIA is related to. So the specific reason for using developmental evaluation is to adapt to changing social, political, economic, environmental patterns, to adapt to emergent developments, identify key forks in the road and the basis for decisions about which direction is taken. That's where, because it is a type of evaluation that assumes from the very beginning that it's a process that's in fluctuating, and that you will probably need to change course throughout the process. It's very iterative. You're coming back and you're assessing things in an ongoing basis, trying to figure out if you're doing the right thing, if you need to change course. And being able to have that frame of reference from the very beginning and documenting that and the decisions that lead to those changes in course, I think could really strengthen a process evaluation findings and provide a great deal more context to it. You might make some of those decisions by looking at documenting the changes that are made, recording any feedback that you got, generating feedback and learnings for ongoing development. You might have contingency planning for decision makers or for the HIA practitioners in the future. You want to ask yourself what's the nature of that decision or the innovation that's going on, what makes the situation or the system complex, and describing those contextual factors to consider. And again, that's where you're looking not just at the process of implementing an HIA, but perhaps broadening your scope to think about the process of implementing that HIA within a complex system that may have a variety of different contextual factors that could be influencing it. There may be turbulence in the economic or the political environment that could influence what's happening. There may be very contentious or controversial issues. You may be exploring new things or targeting new groups where there's really not a lot of documentation on what effects you might be able to anticipate. It may be that some of the issues could be unpredictable or uncontrollable interactions with other things. Many of the actors may be engaged simultaneously in different, sometimes overlapping interventions. There may be some dynamical interactions that could have ripple effects and consequences. And those that have a lot to do with the complexity concepts that Michael Quinn Patton talks about but again, they may have relevance to describing the contextual perspectives and how that relates to the process. The evaluation timeline that you could consider includes how to think about if you're going to engage in a process evaluation, that would happen more at the beginning of an HIA process. Impact evaluation might happen during or immediately following the completion of the HIA. The outcomes would likely happen after the policy changes have been completed or after the HIA has been completed, and would be ongoing for an extensive period of time. You, again, might want to consider whether or not you're going to engage in a self-evaluation or an external evaluation. This would be critical to decide at the beginning of your HIA process, so that if you choose to engage in an external evaluation, you can bring that group on board as soon as possible and have them aware of the process to be able to document it for you. There are pros and cons of self-evaluation and external evaluation. The National Research Council Committee on Health Impact Assessments considers both of those techniques to be essential for moving the HIA field forward. A self-evaluation means that it would be performed by your own HIA team. It can be used to assess things like quality assurance. Did you follow your work plan? Did you follow the standards and guidelines, that sort of thing? It can be valuable in providing insights for you and for the field to some extent, but it's very likely to lack objectivity to some extent. It's just really difficult to be completely objective when we're evaluating ourselves. On the other hand, an external evaluation can provide more objectivity and insights. You might have an external evaluator who would solicit feedback from the partners or the stakeholder groups that you engaged to ask them how they felt like the process went, and people might be more willing to share freely and openly if they're talking to a third party. And it can also contribute to more robust external peer review. Some issues for stakeholder engagement specifically as it relates to evaluation include the degree to which it's important to engage people throughout the entire process. You can think about it as a quality improvement tool to be checking in with stakeholders throughout to see how they feel like things are going. And you want to make time to ask them about how the process is working for them. You can engage stakeholders in soliciting information, monitoring that information. They can play a really important role that way, and you want to think about how you check in with people on the process evaluation and the suggestion for future improvements. You also should be able to measure if stakeholders included vulnerable populations. So thinking about equity issues, you want to ask yourself to what degree were you successful in including vulnerable populations, addressing the needs of vulnerable populations, and from an outcome perspective, you want to be able to measure whether or not the impacts differentially affected perhaps vulnerable populations. When communicating evaluation results, you want to make sure that the messages that you're communicating the complexity of the HIA process in an accurate way. You also want to make sure that your dissemination plan is tied to evaluating your impact so that you are coordinating your efforts in that way. Evaluation can really be of benefit to the HIA practitioner as well as to the field of HIA more broadly. It can improve the HIA process. It can allow us to modify future methods and models. We can assess our accuracy of the predictions that we may have used during our appraisal. We can mitigate unintended negative consequences. There might be cases where we have made specific recommendations not realizing that they could have unintended negative consequences, and evaluation may help us to identify that so that we can avoid that problem in the future. And the evaluation data can help us to support future HIAs and future health and health policy efforts. There is still room to grow in the field of HIA in terms of evaluation. There's not a lot of evaluation data that has been completed or published in the U.S. and relatively few elsewhere. A lot of HIA reports are readily available, but peer-reviewed and graded literature that discusses the impacts of HIAs, again, still rare. Evaluation is important for quality of HIAs. It's important for the success of the field. Lack of attention to evaluation is a barrier that does need to be overcome if we are going to build our practice and strengthen it to advance it in the U.S. We really need to be able to go to decision makers and say, not only is this a great tool, but we can tell you for sure that it's a great tool because look at how it's had an impact and look at the outcomes that have happened as a result that we've collected through this evaluation data. We're not quite able to say that with a lot of assurance at this point. There are 4 macro-level evaluations of multiple HIAs that are currently ongoing in the U.S., and we hope to have some preliminary data that could be shared perhaps at the next national HIA meeting or other venues about the effectiveness of HIAs overall. So although there is room to grow, we are headed in the right direction, and hopefully with new practitioners coming up, learning from the challenges that others have faced and thinking about it more in advance as a way to be able to document that process, we can continue to grow and get better and better every time. And I just wanted to recognize that the following organizations also contributed to the content of this webinar. That includes the Health Impact Project, which is a collaboration of the Robert Wood Johnson Foundation and the Pew Charitable Trust, the Centers for Disease Control and Prevention, and the Oregon Public Health Institute.
This concludes our webinar. I do want to say Health Resources in Action wants to thank the Centers for Disease Control in making a conference grant available to us to make all of this important information about health impact assessments available to our colleagues across New England. Health Resources in Action will be posting the webinars that we have hosted over the past couple of months on our website. The website, which has a specific page on health impact assessments, is www.hria.org. And we will also be sending you a copy of this webinar for all of you who have participated in case you would like to hear it again. You missed maybe a portion of it. Again, thank you all for participating. Thank you, Dr. Avey, for a wonderful presentation. And we hope to be in touch with all of you who may be interested in partnering with us on conducting health impact assessments down the road. Have a good week. Bye-bye.